And her bill, actually, in some areas, might be a little stronger than Bernie's bill. This bill would offer, obviously, Medicare for all, and it would get it done seemingly in 2 years, where Bernie's bill would go be implemented in 4 years. Jayapal's bill...
Who is this?
Congresswoman from Washington State. Jayapal's bill would first extend Medicare, I believe, for people under the age of 19. Then it would create expanded care for people that already have Medicare, so people over 55. And within 2 years, people between 19 and 55, so our age bracket, would have it. It would be full health care, full dental, full hearing, full mental health services, and full care for long-term care. So those senior citizens, those kinds of things. The Intercept has a good piece here. We'll show you that talks about the special interests that were involved in this bill, and it is not the special interests that we usually think about. This time. The legislation, which is being introduced with more than 100 co-sponsors, is the most far-reaching since a Senate version sponsored by Bernie Sanders and includes benefits that are more generous. It also moves to full implementation in 2 years. It also a recognition by Democrats that the opposition party would try to appeal it if you gave them 4 years. The effort includes related legislation that would change the way long-term care is covered. Under the current system, Medicaid is the last resort, which effectively means that the sick and dying must impoverish themselves in order to qualify. The new bill would end that practice and allow people to die with dignity at home. The measure was written with the help of disability rights activists led by the Consortium for Citizens with Disabilities. Keep going. The new law, among its swath of new benefits, would provide dental coverage, a major... Jesus. Hold on. The new law, among its swath of new benefits, would provide dental coverage, a major boost to the health and quality of life of millions who suffer constant toothaches, or worse, for lack of access to dental care. I could attest. I've spent $5,000. I've spent $5,000 on two root canals, and growing because I have to go back the last year.
I can tell.
Along with the Consortium for Citizens with Disabilities. Your breath has nothing to do with your teeth. Anyway,
absolutely. If you have a cavity, it absolutely has everything. I don't have any
cavities now because
if you have to get a root canal, that means if they didn't do it right and you got the blood still coming in, the blood is affecting. You know what I'm saying? I can see the words coming out your mouth right now, like.
Along with the Consortium for Citizens with Disabilities, the main groups involved in drafting the legislation were National Nurses United, major nurses union that has long been on the forefront, Physicians for a National Health Program, the Center for Popular Democracy, Public Citizen, and Social Security Works. Noticeably absent, and this is fantastic, the Center for American Progress, which is Neera Tanden's fake progressive group, and also noticeably absent were Big Pharma, the insurance companies, doctors, and hospitals. 2-year implementation is very good because Bernie's is 4 year. I don't know why Bernie's is 4 years versus this is 2 years. So far, this bill that was introduced doesn't have the specificity that This bill that was introduced today doesn't have the specificity that Bernie's does as far as how we would pay for it. Bernie is very clear how we would pay for it with tax increases, not only on wealthy people, corporations, but also that, everyone's going to have a modest tax increase, but you're going to save more because you don't have deductibles, co-pays, co-insurance, and all that. So without getting into like full detail of the plan, because honestly I need more time to look at it, what I like is more plans. More plans are coming out for Medicare for All, which only mainstreams Medicare for All and a single payer system more. The fact that she had 100 co-sponsors in the House is a positive thing, because I guarantee you a large number of those co-sponsors would have not co-sponsored this 3 years ago, 5 years ago. But now that it's polling at 70%, you could thank Bernie Sanders for that. More politicians are having some political courage. And now it's becoming what called the Overton window. We're moving the Overton window way to the left. So now things that were just like tree huggers were for the Green New Deal 10 years ago. Socialist, welfare queens wanted universal health care 10 years ago. Now,
welfare queens, that's
Ronald Reagan's.
Well, I'm just saying, it's one of those words. So I don't know if you guys knew, back in the 70s, they came to the conclusion that it's just not good politics to say nigga and black person and this. So we use code words like welfare queen and like these words that we use that that will insinuate we're talking about black people.
Yeah. So I think this is a good step. I think if I want to see more specifics, but specifically dental care, hearing, long-term disability, and extended care for long-term illness is a positive thing. I also think you got Bernie's in the Senate, you got Congresswoman Pramila Jayapal's in the House. I say if Bernie's running, meld a few different plans together, get it out there. Because I think 2-year implementation is key. Because 4-year, I mean, you're leaving it to what if Republicans retake the House?
That's true.
In a 2-year midterm, or what if Republicans what if it passes under a Democrat, and then in 4 years?
For the most part, that could possibly be a thing. I mean, to this day, I can't see who would run against Bernie Sanders, but who would not enjoy like the benefits. But everything takes a little bit to get off the ground.
Right.
You know what I'm saying? They made a good analogy. They said running for president is like, and becoming president is like having a startup, and then the next day you're running $1 billion corporation. It's like literally that's what happens.
Right.
That's how it is. And so obviously, I don't care how long Bernie Sanders has been in the Senate. It's still going to be some sort of learning curve that he's going to have to navigate in. And 2-year plan is way better than 4.
Right. And I also think the key here is moving the psychology of this all. Bernie Sanders talking about it as a human right. So is Pramila Jayapal. Getting rid of the capitalist, oligarchic, plutocratic talk that, it's not a right. It's, people have to work hard. Your employer gives it. You could get it from your employer if you have a job. Well, as Bernie said during the town hall with CNN, go talk to people who have employee health care and ask them how much they love it when they still have high copays, when they're being asked to pay more into their health care plan. Most people, if you give them the choice between it being completely free and paying slightly more in taxes versus having more taken out of their paycheck, no.
Slightly more in taxes all day.
Right. And as Congresswoman Jayapal's bill says, in addition to Bernie Sanders, hey, you want cosmetic surgery? There will be private health insurance for you. Yeah. You want specific things that is not offered in the government plan? You could go to private health care. It's the same thing as free public college.